Frozen shoulder is a common condition in adults 50 plus, and we've seen firsthand how distressing and disruptive it can be.
We want to help you understand what frozen shoulder is and how you can overcome it.
Hi, it's Brody and Alicia, two of the physios here at Be Mobile.
Frozen shoulder is a strange and often misunderstood condition.
Let's talk a little bit about what it is and then get into some exercises which can help you. Frozen shoulder is a condition characterized by often severe shoulder pain and functional restriction of shoulder range of motion, in which x-rays of the shoulder are unremarkable.
Essentially, this means that there's no fracture, dislocation, or anything else that could explain the symptoms. The exact cause is unclear, but we do know that it involves an inflammatory and immune system reaction.
This leads to cells within the shoulder capsule becoming thickened and contracted, which leads to stiffness, pain, and a loss of function. Around 5% of people will experience frozen shoulder within their lifetime. Risk factors include having diabetes, being obese, having previous shoulder injury or surgery, and there is a genetic component too.
It occurs almost exclusively in people aged 40 to 65, with the mean age of onset being 53. As physios working with adults 50 plus, we've seen our fair share of frozen shoulders. Unfortunately, frozen shoulder can persist for a long time, with some people having symptoms up to several years later.
However, the good news is that for most people, it improves significantly within the first few months. The majority of people have most of their range of motion and low pain levels by the 1 year mark. But of course, this can vary person to person, and you might improve faster or slower than that.
Even more good news is that once you've had it, it's extremely unlikely to occur again in the same shoulder.
Exercise is effective for frozen shoulder, and it's one of the better things you can do. Lots of different types of exercise can be helpful, including strengthening, stretching, and mobility exercises. Working with a physiotherapist to get an individualized plan for you can be a good idea if possible.
Corticosteroid injections can be effective, especially in the early months, so this is worth discussing with your physio or doctor. Surgery is not routinely recommended and should only be considered as a last resort.
All right, let's go through 5 exercises you can do for your frozen shoulder. Now, the truth is there's no best exercises. Anything that's using that shoulder will likely help, but these 5 are ones that we found to be fairly effective. For all of these exercises, you want to focus on going slow and steady, just using light loads for any of the exercises with weight, and a bit of pain and discomfort's okay as long as it's tolerable for you. The first exercise is a table slide, which is a great way to work on the flexibility and mobility of the shoulder. Helps to have a little folded towel because that can help you slide along the table. Imagining this left arm is the one that has the frozen shoulder, I'm just working on sliding forward and coming back within a range of motion I can tolerate. To start out with, you can use the other arm to provide a little bit of assistance if you want to. As you progress the range of motion, you can try and slide further and further, but that may take some time. So quite simple, that's the table slide. I would typically do 20 to 30 slides, having a bit of a rest and repeating that up to 3 times. And this is something you can do every day to work on improving that flexibility.
The second exercise we have is the bent over row. So this is often tolerated really well in those with frozen shoulder. First of all, you need a sturdy surface, which I'm going to lean on. And I'm actually going to start just with the weight of my arm. So I'm pulling up like that, elbow towards the roof, and I'm really working a lot of muscles in my arm here, my back. It's a great exercise, and like I said, well tolerated. Now, you can add anything lying around the house. You can add a milk bottle or a tin of tomatoes, something from the pantry, and same thing, pulling up like that. And as you progress, you can add more weight, so doing it with a dumbbell, and you can even do a double arm version. So I've got a weight in each hand, hinging over, and elbows up like that. I would recommend doing 10 to 15 repetitions of this exercise for 3 sets.
Exercise number 3 is a floor press. You can do this on the floor, but you could also do it on a bed or couch as well. What we're going to do is get down into this lying position, and it helps to have a folded towel here or a pillow to support the hand. Imagining this left arm is the one with the frozen shoulder, and we are working on just pushing up towards the ceiling and back down to the towel or cushion. Pressing up and back down, just for whatever range of motion you can manage. Once you're doing that pretty well, we can add a little bit of weight. You can just use something lying around the house or a dumbbell if you've got it. Holding the weight in that hand, and we are just pressing up to the ceiling, back down. As with all of these, going fairly slow and steady. So that's it. That's the floor press exercise. And I would do this for maybe 3 sets of about 10 to 15 repetitions.
Before we get into the next exercise, if you're enjoying this video, hit like and subscribe. The 4th exercise we have is external rotation of the shoulder. Now, typically this can be a difficult movement for those with frozen shoulder, but let me show you how to do it. We're going to lie down on our side and we're going to grab a towel to rest our elbow on. That typically makes it more comfortable. Now, in the early stages of frozen shoulder, you'll probably find you cannot move very much at all in external rotation. That's this movement. But I have no weight at the moment, and I'm just trying to rotate my shoulder externally, which lifts my hand further up. And even just trying to initiate this movement is going to be helpful for you. Now, as time progresses, you'll find that you'll be able to get more range of motion. So against gravity like that. And as you start to get more range of motion, you can add some weight. So I have a dumbbell here, but you can use anything around the house. So coming from my stomach, keeping my elbow resting on the towel and rotating like that. So this is really targeting the muscles in the back of my shoulder, the external rotators. So typically, I'd recommend doing 10 to 15 repetitions of this for 3 sets.
All right, the 5th and final exercise we have for you is a version of a plank, which is great for getting some static loading of the shoulder to start to help with its strength. The higher bit of furniture you have, the easier it's going to be. So we often start with something like kitchen bench height. You're going to put both hands on the bench and walk your feet back just a little bit. So we're just taking some load through the shoulders. And this can be your starting level, and you could hold 30 to 60 seconds like this. Imagining my left arm is the one with frozen shoulder in this scenario. We can progress a little bit by walking the feet further back, and that's going to put more load through both arms, and also moving to lower levels of furniture as you get stronger, because once again, that increases the load on the shoulders, okay? The final progression, once this arm is really starting to get stronger, is to take all of the load through this arm. So that's when we'd add a shoulder tap. So I'm here in the plank position. My left arm is the one with frozen shoulder, and I'm going to use my right hand to touch and come back down. So I'm reaching up towards the shoulder and touching back down. So for those few seconds, the left arm is taking the vast majority of the weight. To show you front on, the easier version, both arms taking equal weight, and then the progression later down the track, once you're ready, tapping. And as I'm tapping for those few seconds, that left arm is taking all of the weight. So I might do 3 lots of 30 seconds to a minute with any of those plank versions to start with. And then as you get a little bit stronger, you can progress to those harder versions. When it comes to frozen shoulder, you should continue to keep using your shoulder as normally as possible in daily life, within reason. And don't be worried that you're going to make it worse, because that's not going to happen.
Regularly performing specific shoulder exercises, like the ones we showed you, will help recovery.
In the meantime, you should keep up all other physical activity for your health and fitness. This might include strengthening for all the other parts of your body that aren't affected, as well as aerobic exercises like walking, swimming, or getting on a stationary bike.
Above all, be patient and stick with it. It can be a tough road, but you will improve with time. Before you go, if there's someone you think might benefit from this video, please share it with them.